Buoy Health Insights, Fever. Welcome to Buoy Health Insights. Today, we're diving into the causes of fever and what it means for you. Remember, if you find this information helpful, don't forget to hit like and subscribe for more health-related content. So, what's a fever? A fever occurs when your body temperature spikes above the average range, which is around 97 degrees to 99 degrees. This increase typically happens when the hypothalamus, the temperature control center in your brain, turns up the heat to fend off infections. Accompanying signs may include feeling flushed, sweating, chills, muscle aches, and tiredness. While fevers are commonly associated with the flu or a cold, they can also be a symptom of serious conditions, such as pneumonia or appendicitis. Now let's dig into potential causes of a fever and the associated symptoms that can give us clues as to the underlying issue. 1. Mononucleosis, colloquially known as mono, is a viral infection that can cause fever, sore throat, fatigue, and swollen lymph nodes. Commonly spread through saliva, it's often dubbed the kissing disease. 2. Influenza, known as the flu, can bring on fever, cough, congestion, headaches, body aches, and sometimes gastrointestinal issues like nausea or diarrhea. The flu can progress to pneumonia in at-risk individuals, so it's important to monitor symptoms and seek care if they persist or worsen. 3. Pneumonia is an infection that causes fever, cough, potentially with mucus, breathing trouble, fatigue, chest pain, and confusion, particularly in the elderly. It's a serious ailment that demands timely diagnosis and treatment. 4. The common cold can present with a runny nose, cough, low fever, fatigue, and mild body aches. Most symptoms are manageable at home with rest, fluids, and over-the-counter medications. 5. Sinusitis, an infection of your sinuses, can lead to fever, runny nose, congested feeling, facial pain or pressure, and a cough. Persistent symptoms might necessitate antibiotics. 6. Strep throat, a bacterial infection, can give rise to fever, sore throat, painful swallowing, and swollen lymph nodes. It's highly contagious, often requiring antibiotics to prevent complications. 7. Gastroenteritis, or stomach flu, can trigger nausea, vomiting, stomach pain, diarrhea, chills, and fever. Severe dehydration might require hospitalization, and symptoms can sometimes resemble more serious conditions like appendicitis. 8. COVID-19's hallmarks include fever, loss or change of taste or smell, cough, and fatigue. Symptoms overlap with the flu, and those with mild COVID-19 should prioritize rest and hydration while keeping their doctor informed. 9. Cancer, particularly certain blood cancers, can cause persistent low-grade fever or intermittent fever, weight loss, swollen lymph nodes, and fatigue. It's crucial to seek medical advice if these symptoms are present. 10. Autoimmune diseases such as lupus and rheumatoid arthritis may produce a low-grade fever alongside fatigue, joint pain, and other symptoms, requiring a tailored treatment approach. Other fever causes include tick-borne diseases like Lyme disease, urinary tract infections, and less commonly, conditions such as blood clots or tuberculosis. Remember, accurate information, including the measured temperature and any medicines taken, is vital when discussing your condition with a doctor. Now, let's talk about when it's time to seek medical attention. Consider calling the doctor or visiting the emergency room if you have a moderate to severe fever over 102 degrees, your fever's been persistent for more than 3 to 5 days, you have a weakened immune system, or you're at particular risk, such as being pregnant or recently having had surgery. For children, the guidelines are slightly different. Contact your pediatrician if fever-reducing medications aren't working, your child isn't eating or drinking, or they seem to be in undue pain. Infants, especially those younger than 3 months with a fever over 100.4 degrees, require immediate medical attention. When it comes to treatment, simple at-home care can include bathing with lukewarm water, staying hydrated, and taking fever reducers like ibuprofen or acetaminophen. If the fever's cause is not easily identifiable or isn't responding to at-home measures, medical testing, IV hydration, or prescription medication might be necessary. Most fevers are temporary, but it's important to support your body with rest and hydration. Remember, while a fever can feel dreadful, it's often a part of your body's natural defense against infection. We hope this video has been informative, and remember to like and subscribe for more Buoy Health Insights. Stay healthy!